I'd like to start our discussion today with you, Junice, but in welcoming everybody, we put this panel together with the idea that this would be both our moment of recognizing impact for Family Planning 2020, but also hearing again your particular perspectives. You've all been important partners to all of us. And so by starting out with Junice, we wanted to start out with some of the cultural, social, and legal norms that can sometimes be an impediment to progress in countries. The Philippines fought for decades to ensure the right to family planning, and Junice, you and many others advocated for the reproductive health laws and policies to meet the needs of women and girls in the face of fierce cultural and social resistance, including from the Catholic Church. How has involvement in the FP2020 partnership supported Likhaan, other advocates, and the government to achieve the progress that you've achieved in recent years?
I think the values of FP 2020 jives with the values of advocates for reproductive health that have been fighting for the reproductive health law for 12 years. And it was very important. Very important in your contribution was your emboldening the national government to actually invest publicly, explicitly for family planning, because they were latecomers in the game. They came, and I think you can understand the vacillation because of the strong influence by the Catholic Church, but their commitment to you in 2012 signaled changing of the norms. I think whatever happened, maybe because of the global movement behind FP 2020, our leaders actually, who are not used to pledging publicly commitments, in fact, they tend to camouflage that because of the backlash. That was a breath of fresh air when they came out. And I think that signaled to everyone that like the Catholic spell on policymakers had been broken. And it was the start of government and civil society organizations, private organizations, development partners coming together actually to implement what was the explicit, the very explicit, very public declaration of government. So that was a big step forward in 2012, when we were not sure, actually. It was a bold declaration. We weren't sure when the Secretary of Health pledged that they would pass the RH bill, that it indeed would pass in December of that year. So it was a very precarious statement, but we were very happy with it. And I think it started this cooperation, this trusting between non-government people and the government.
Thank you, Junice. I think you beautifully articulated one of the strengths of this partnership, which has been around creating norms, creating really a community of practice that supports women's rights. And that context is different everywhere. The challenges are different everywhere. But at their core, they stem from this same resistance around empowering women and this change of practice about just a real autonomy, and that women should have agency. And we feel that differently around the world. Alvaro, working with the Planned Parenthood Federation, you surely see that in many different contexts. I'm wondering if you can share from IPPF's perspective what the value of this partnership has been and how these issues are playing out for IPPF member associates or affiliates.
With pleasure, Beth. Thank you. Yes, of course, IPPF being present in over 150 countries, we can see this all over. I'd like to start saying, like many others, we joined this partnership at the beginning because we felt there was real value and we could achieve more if we worked in a more joined up way. And we joined the partnership through the reference group, but also through participating in the performance monitoring and evidence working group, and also working closely with the Secretariat on how to do more and how to do better in humanitarian crisis. From the work of the performance and monitoring and evaluation working group, I'd say that we benefited in many ways, but particularly from it becoming a forum, or maybe the forum, for establishing common family planning indicators, bringing donors together to agree on measurements and establishing and galvanizing support for global common FP indicators. So that, I would say, was a big success. But the key question for us was, would this really translate at country level? And how could we help make this work at country level, bringing together civil society into this partnership that was across sectors? If you give me 2 minutes, I just mention as an illustration the work in West Africa, which is from my point of view, one of the regions where FP 2020 really helped change country level dynamics. We have 9 member associations there, so we can see it quite broadly, and they played a key role both in the Ouagadougou partnership, but also in FP 2020 as focal points. And if I think of, for example, Côte d'Ivoire, where we co-led the setting up of a coalition of sexual and reproductive health civil society organizations to enable joint efforts in line with the FP 2020 agenda. That coalition is now in its 5th year and has around 20 members. It has developed advocacy actions to enable a favorable social legal environment for family planning and SRH more broadly in Côte d'Ivoire. And it has also served as a way of holding the government to account, monitoring the implementation through something we call the motion tracker that was first validated in 2019. And that's just one example. I mentioned Côte d'Ivoire, not because it's extraordinary. I could have told similar stories from Burkina, from Nigeria, from many others. So not because it's extraordinary, but because I think it's a good illustration of how the partnership has really made SRHR advocacy issues more effective and has been able, as Junice was saying, to capitalize contributions from CSOs alongside the government.
Thank you, Alvaro. I'm glad that you did share that story because we have many partners who for a long time have been working on the supply side for family planning, including important partners like RHSC, and that work remains critical. But we all know that expansion for family planning programs and for SRHR more broadly really rests on the ability of advocates to change some of these social norms, again, around autonomy, and to make sure that women have the commodities then that they need to find something that works well for them and that's right for them. And the more then the women are accepting, the better able we are to change the programs and strengthen them and improve quality over time. Comfort, I'd love to hear from you now, from your perspective as a young woman and as a youth advocate, about how working with youth advocates has improved over time and what we've learned together about what meaningful youth engagement actually is. We all talk about it, but are we doing it well? Are we really opening up the seats of power and inviting young people to lead and to be a part of those discussions in a way that's transformative? I'd love to hear your perspectives on that.
Thank you so much, Beth. Are we doing good in terms of involving young people in different platforms? I think we're not yet there, but so far so good. I'll give a classic example of the FP 2020. Initially, we never had a youth focal person on that platform, but we've seen it grow to the point that we're able to identify, or rather create space for youth to be able to sit at the table with the introduction of the youth focal person, which was recently introduced. I think the problem that most of these platforms, organizations have is the fact that we usually put a young person just for show. As a form of tokenism, we just put them for people to recognize that we have a young person in different platforms. But I think moving forward, it's good that young people should be fully engaged from the onset up until the end of these engagements. And as I was giving an example that, yes, I think we are sort of improving from my point of view. because we're able to have a youth focal person, and we're able to furnish them with the necessary equipment for them to be able to participate in different activities as well as in different platforms. Recently, I think through the FP 2020, young people, young focal people were able to be given a small grant for them to be able to carry out different activities. So I think that's in a way that's empowering a young person to be able to contribute and partake, because at the end of the day, if you just put the young person there without furnishing them with the right equipment for them to be able to contribute, that's basically just a waste of time. But we're not yet there, but I think we're getting there. Slowly, I think we'll be able to get there and fully engage young people in different platforms. Thank you, Beth.
Thank you, Comfort. And I couldn't agree more. This partnership has been a learning process for us throughout its evolution. And one of the things that we have seen is that we need to make this shift of thinking that we're providing a gift to young people by inviting them in, instead of treating them like the professionals that they are, and providing the kind of support that allows the networking and the engagement that you're describing. And I hope that we'll be able to lean into that more in the next iteration of the partnership, specifically because we know we have to work much more on this normative side of the partnership, but also because funding is ever tighter for advocacy. And yet this is the moment when we need to really lean into it. So Junice, I'd like to come back to you, if I may, and get your perspectives as a service provider, but also as a lifelong advocate for these services, to hear how that's working for you in the Philippines and how that works for your partnership with the government in terms of making progress on the Philippines commitment. I can't hear Junice, so I'm wondering if her sound hasn't been turned on. There. Unmute yourself, Junice.
Yeah, I'm so
There
sorry.
you go.
I muted myself. Yeah.
That's all right.
I think I was saying that we are in a very unusual place because we do run clinics in very poor communities. So we are in touch actually with what common women, actually poor women, have lots of discomfort with their providers, lots of rights-based complaints. No, but we are able to raise that at the policy level. So this is important, I think, for many women's groups that are working on the ground, working in the community, actually knowing exactly what's happening and how acceptable the access of services has been to them. But raising that, we have been able to do that. And I think your FP 2020's focal points on CSO actually legitimized the important role of civil society organizations, especially women's and young people's organization, to bridge that yawning gap between the communities with their own probably misgivings, some, but a lot of long time neglect, the feeling of neglect, and letting them seize on the opportunity actually to access services, but also to make decisions for themselves. So actually that is the important role of women's and young people's organizations. And we are trying to do that in our country. So we have this vast reproductive health advocacy network that is made of different sectors, but especially those who really have difficulty in accessing and who have been neglected in policy. And we bring them together at the National Implementation Team for the reproductive health law, which was part of the law. So this law, and I think the focus of FP 2020 on participation, on hearing the voices, because eventually it will be the community's acceptance of family planning that will make a difference in our progress. So I think that this is all very good, and I hope that that commitment to community participation and the interface, the many interfaces between provider and women and young people and policy making, I hope that continues. Thank you very much.
I hope it will as well. That's our intent. You know, we had a focal point workshop in the Philippines that we co-hosted with Junice and many others in 2016. And for those who are unfamiliar with focal point workshops, they bring together the country teams, the government, donors, usually USAID and UNFPA, and then a civil society representative like Junice, and now a youth representative like Comfort. And they work together over the course of a number of days through a range of issues with technical experts. And it gives everybody a chance to look at their plans together, to learn from each other, to learn from other countries, and to have common cause for family planning programs. But when we were in the Philippines, we were really moved by the incredible energy of civil society. I had so many other partners from the 16 other countries in the region come forward and say that that vibrancy was really inspiring to them as well, and they felt a connection together. And so to me, that's one of the great values that FP 2020 has brought forward, is creating these regional communities of practice that then, filter up to that sort of global movement as well. I'd like to shift from focal points and thinking about focal point movements, Alvaro, to talking to you about the engagement of IPPF overall in this movement. I remember when the global gag rule was reinstituted, having conversations with IPPF and MSI and others about what had happened previously, that because of this sort of a fracture in the community and the need to find funding elsewhere, that the relationships had sort of floated away over time as well. And so we made a specific decision to ensure that MSI and IPPF remained on the reference group to demonstrate that people could have different opinions. They could make their own funding decisions based on their own frameworks, but that we as a community were going to try to find a way to work together. And that held throughout FP 2020, and in large part, that was through your engagement. So I'd love to hear your perspective on the reference group and its impact, and how you feel IPPF in your personal engagement there made a difference.
Thanks, Beth. And it's not always easy to separate the reference group from the work that you and the wonderful team at the Secretariat did to sort of make it possible. So let me start by just thanking you all for the support you provided to make the reference group successful. I think, as you say, for the last 4 years, for what I would say has been a challenging 4 years with disastrous policy coming from the Trump administration, the FP 2020 managed to remain as the one convener where the US government and staff and technical people and implementers like ourselves and other donors came around the table to be able to plan together, to strategize together, and to commit to a way forward. I think maintaining that dialogue, keeping the channels open, is a fantastic achievement. Without it, the disaster would have been much greater. We would have been able to achieve much less. So I'd also want to thank the staff at USAID, at CDC, and in other places that remained engaged through these difficult circumstances and coordinating with us. So I think we need to protect that convener capacity that FP 2020 has had in the reference group, and not just bringing donors and governments together, but bringing them together with civil society and bringing in also humanitarian players. And I would say since 2017, that has been another feature of FP 2020 and the work of the reference group, that spotlight on humanitarian settings. And that's a good example of where it's difficult to differentiate the work of the reference group and the Secretariat, because that was partly made possible because of the partnerships you created, including with us, to sort of move that humanitarian agenda forward, but also because of some of your staff. And I'd like to remember Jen Schlachter, who was a formidable force in this respect and helped us move forward. So I think that the reference group in that sense, and probably that has been its greatest strength, has been the convener where we were able to discuss from different points of view, from different perspectives, but with a common view and a desire to join up our action and our work to have greater impact. Thank you.
Thank you. I couldn't agree more. And, I think that's really part of the beauty of this partnership is many people saw an opportunity in it to advance their work and their perspectives. Jen came to our team because CARE approached us at the 2017 summit when we first talked about humanitarian work and the need to link up, especially with regard to the MISP, and offered a fellowship. And so we were able to welcome Jen onto the team and to take that work forward. And it really opened a door to a new kind of conversation that hadn't existed for family planning before around preparedness. And we'll talk a little bit more about that later. But I agree that there's a space there for new ways of working, new ways of thinking together and leading to greater creativity. So we just have a few minutes left. So time passes so quickly with these. Comfort, I want to turn to you and maybe give you the last word, because I know that you and many partners working in Malawi have had a major victory in avoiding cuts to the family planning commodity budget for 2020 and 2021, despite COVID, and actually increased funds from 176 million kwacha to 200 million kwacha. Can you talk about how this change is benefiting young people?
For starters, I would like to explain that one of the major causes of an unmet need for a young person is the frequent stock out of commodities in the facilities, in the clinics, and everything else. So the fact that the government was able to allow the increase in budget from 176 to 200 million, as you earlier mentioned, this will really help because it means that there will be more commodities which will be used, especially when we are conducting outreach, because at the end of the day, you should imagine a young person who has traveled a long distance to try and access family planning, later on to realize that after getting there are no commodities. So it's really devastating, and it becomes really challenging for young people to continuously try and access a service they can't really find. So the fact that the government was able to raise the budget, it means that there will be a range of commodities, meaning that if as a young person I didn't find what I was looking for, I'll be able to choose another one. But besides that, it also means that they'll be able to have an increased number of outreach, whereby these services will be carried over to the typical hard-to-reach areas, which is really a good thing. So I would also like to commend the partnership for helping out in consultation and everything else to try and make sure that the budget was actually increased from 176 million to 200, which is a really good thing, as I earlier mentioned. Thank you, Beth.
Thank you so much, Comfort. We actually have a few more minutes left. Doing these live events is a little tricky with regard to text, so I'm glad that I was told we have a few minutes more. Gives me a chance to ask you another question, Junice, because one of the features of FP 2020 is that we were funded pretty early on through Bloomberg Foundation and then the Gates Foundation and DFID and a few others to have a rapid response mechanism that we were able to use for small investments, not meant for long-term programs, but really when there was an opportunity to make a significant change that we could infuse quickly some funding to take something forward. So could you share your involvement and the success of a rapid response mechanism investment?
Yes, the rapid response mechanism actually helped tide over like a crisis situation in the Philippines when there was first one was actually helping us do a research to overturn a temporary restraining order it was used actually to overcome a temporary restraining order by the Supreme Court on contraceptives approved by the FDA. So this again was a move by the anti-reproductive health movement, and they succeeded actually in staying the commodities for 2 years before the FBA was able to justify that none of those 48 products held were abortive fashion. And our research actually, in their decision to approve all 48, they cited 2 studies that we included actually in that research that was funded by RRM. The other is actually in anticipation, again, of opposition to comprehensive sexuality education. We actually were able to gather stakeholders from different areas, not just young people, but also parents, community leaders, health providers, actually to make a stake for CSE, because that was questioned in the Supreme Court. So there is actually a pending decision by the Supreme Court said that it was premature to rule on the unconstitutionality of CSE until the DepEd rolls out its curriculum. The DepEd is about to roll that out. So I am hoping that the phalanx of advocates that we help to beef up actually the defense, the local and the national level through the RRM would be able to help us defend, and I think even to popularize CSE to communities and at the national level.
Thank you, Junice.
Thank you, Beth.
It does seem fundamental that young people, all people, should have access to comprehensive sexuality education, to understand their biology, to understand sexuality, and to be able to live their lives informed so that they can live safely and freely. So now I really will turn to you, Comfort, for the last word. And I think this is a great segue because I'd love to hear how Malawi has focused on reaching stigmatized populations, including young people, LGBTQI people, and sex workers. Do you feel the movement has made progress in this area, and how can we achieve more in the coming decade?
Again, I would still say we have a very long way to go. However, I would like to commend the government of Malawi for highlighting, of course, not broadly, but a little bit tackling the issue of key population. So basically, they were able to recognize the presence and also able to highlight their rights in our national youth-friendly health services strategy, where they're able to indicate how we can be able to reach to key population members, and specifically the female sex workers as well as the LGBTIQ and everything else. So through the strategy, which is the 2015 and 2020 strategy, they were able to highlight how female sex workers can be reached out, whether it's through the outreach and the drop-in centers with different sexual reproductive health services. So I think that's quite a good thing, because it shows that the government was able to recognize that we have key population amongst us, and it's good that sexual reproductive health services should reach out to all population, leave no one behind, as we usually say, because the moment you leave key population behind, it means we're leaving a huge population behind, which in a way can come back and affect our overall goal and objectives. Yes.
Thank you, Comfort. I'm very glad to end this discussion on that note, because just as the complexity of the partnership has evolved over time, it does so in realization that there isn't just one woman, one girl, one person who needs contraception. We're all complex beings. We live in complex societies, and the partnership in our response needs to be able to adapt and respond to those realities. And by creating a space where everybody can come together to share their perspectives, to work together to overcome barriers, I think that becomes our greatest strength. FP2020 is not a funding mechanism, but we're a partnership of many people with many different authorities and abilities to function in our own communities, both locally and globally. And I believe that's the strength of the FP2020 partnership that we'll be taking forward into 2030. So I want to thank all three of you. It's been such a pleasure to work with you and to get to know you as people. It's really been an honor. Thank you for being with us today and sharing your perspectives on FP2020.